explaining that from the early work we did to establish the mouse model at Pompe that led ultimately to the testing and authorization of Myozyme. That was in 2006. So we were participating in the pivotal studies for Myozyme, which ultimately now in the US is called Lumazyme. And it's a little confusing because in Europe it's still called Myozyme. But then along the way, there have been other products that we've evaluated both by BioMarin and second generation products by Sanofi that have shown some promise for improving the outcomes in Pompe, more so in the late onset disease than in infants. They're not fully authorized for the infantile onset disease where there's still a significant unmet need. But the work at Amicus was really began when we understood what the limitations of Lumazyme and Myozyme were, and the scientists there helped develop a strategy for stabilizing the enzyme with a second drug. So this is a two-part therapy of Pombiliti and Opfolda that is an oral part of the treatment that helps improve the availability and of the optimized protein therapy component. So together they're called ATGAA, but it is always going to be helpful for the patient community to have options. And now that there's newborn screening for Pompe, which was an important part of the Muscular Dystrophies Association effort to advocate for newborn screening and to conduct a patient-focused drug development meeting about 4 years ago now. We've learned what's the expectation of patients to have a better outcome, and this drug addresses some of those because it seems to enhance the function of the enzyme replacement to have the combination of miglustat and the protein therapy together. I think a lot of the mechanism of action of the combination, it may not address one of the central problems that's still being sorted out in Pompe, is what is the impact of the central nervous system involvement. But it certainly will improve access to the treatment. I don't know that there's any pricing information that's been released yet, but one of the stated positions of Amicus was that they were intended to improve access to treatment by addressing the high cost of VRT. And we probably will learn in the next few days or weeks what that looks like, because if they can manufacture the product at a lower cost, or they're willing to have it be available in more countries, this will help the patient community as well, because there are some circumstances where patients don't have access because of the cost. The combination, at least early on in the studies, and we'll have to learn more in the real world assessment of patients, but it looked like the frequency of infusion reactions was actually lessened in the combination therapy. And that becomes a challenge for patients, obviously, because the infusions become longer. They have to receive additional medications if that is ongoing. And so if that holds up to be the case in the wider population, that'll be beneficial. I think there's an interest even in changing the way it's formulated so that it could be self-administered. That would be a great advancement. They haven't announced that publicly, so I wouldn't address that specifically, but you can imagine ways in which this could be administered faster, enabling home infusions, and this is going to improve the quality of life for patients who it's a significant burden to have alternate weekly treatment. So if anything can be done to lighten that the challenge of burden of care And then we'll see whether it's as effective in younger patients, because now with newborn screening, if we had some evidence that earlier treatment leads to an improved outcome, then and this drug is available at a lower cost and with a less burden of care, then you could imagine people will adopt the therapy sooner. The study done by Amicus is one of the largest studies in late onset Pompe disease that's been done. And so maybe 40 plus countries, 120 some patients, and you can refer to their press release for the exact numbers, but it's just been such a comprehensive effort on their part to understand everything possible about this product and its comparison to Lumizyme. I think in the real world experience, we'll see, the real benefit from studying patients long-term, as we do at the Muscular Dystrophy Association care centers. That's one of our mission activities, is to follow patients long-term through the MOVER registry. And Pompe is one of the conditions where we'll continue to collect outcomes data on products like this one. So yeah, very important effort from the MDA to understand long-term outcomes, and that's where we'll focus over the coming years.